How do you utilize the method for reducing the curve progression risk?
Yeah. So what a typical, I think the best way to answer that would be like what a typical examination would be like, and then go from there. So how we reduce the curvature progression risk is that we have a patient come in, and these patients that could be at risk of progression, they can sometimes be adults or they can primarily be adolescents. A majority of scoliosis still is idiopathic, meaning there's no specific known cause at this time. We think there's a genetic link. A lot of times a mother or a father that had it that's progressed, or a high level curvature, they have a chance to pass it down, but there's still some information lacking with that. So if I see an adult with scoliosis that's at risk of progression or an adolescent, we'll do an examination where we're going to look at the blocks of the body. Typically, there's either like 3 curve patterns or 4 curve patterns or singular patterns. When we say curve patterns, we're thinking about like different blocks of the body. So we think about the hip and the pelvis, we think about the back, we think about the thoracic spine and the effect on the shoulder blades. Then what we do from there, looking at the curve pattern, we're then going to have the patient draw it to them, or whatever. We're going to ask them, just like we would do with a mechanical exam. The patient's the expert on their symptoms and how they behave, and you need to get out of them how to educate them and how to teach them a program. So we'd have the patient, we'd go through their curve classification, we'd show them where their deviations is. Do they have a pelvis that's out to the left or right? Do they have a lumbar curvature that's dominant, that's causing them to put more weight on that dominant side? So example, a common curvature would be a curve to the right of your thoracic spine and a curvature to the left of your lumbar spine, because the heart's on your left and tends to be that way. And typically the dominant curvature bears the weight. So if you have a curvature that's dominant on the left lumbar spine, typically that concavity will cause that right hip to then move out and put your weight through your left. Once we draw this with different little blocks or boards and things like that I would do with the patient, we then talk about how to position themselves in a unloaded position without gravity, lying down in their stomach or their side or their back. And we are always monitoring pain for that. And we would use the MDT assessment to address if they have pain from scoliosis or not. But what we're talking about is specifically how to reduce the curvature. And so we would then take them in a position that doesn't have gravity eliminated to then progressing to the more functional position, sitting, standing, taking their curvature and correcting it in 3D and correcting it that way.